Hello everyone. Today we are going to see the topic insomnia. I am Soumya, Assistant Professor, Department of Mental Health Nursing, E.S College of Nursing. The definition of insomnia is it is a common sleep disorder characterized by difficulty in falling asleep, staying asleep, or waking up too early and not being able to go back to sleep. It can lead to daytime fatigue, irritability, and difficulty in concentrating in our day-to-day works. Next, we will be seeing about the different types of insomnia. So, it is two types. One is acute insomnia and the other one is chronic insomnia. What is meant by acute insomnia means it is a short-term insomnia lasting a few days or weeks, usually due to stress, illness, travel, or life changes. Next one is chronic insomnia. It is a long-term insomnia which will be lasting for more months or even longer. Often it is caused by underlying medical, psychological, or lifestyle factors. Next, we are moving on to the etiology. So, if you are seeing in the etiology, the first one is due to the psychological factors. It might be due to some job stress or job stress and workplace stress, anxiety or depression, and then overthinking or racing of thoughts, trauma or grief. Due to this also we will be getting insomnia. Next one is due to the lifestyle and environmental factors. If you are seeing in this, the first one will be due to the irregular schedule of sleep, because as we are using the mobile phones frequently and in the late nights, due to that we will not sleep properly, and we will be sleeping at 12 o'clock, and the people will not wake up in the morning also. Due to that, the sleep pattern will be disturbed very much. Next one, as I told, excessive screen time before bed, due to which that blue light from the devices will not let us to sleep. Next one, consuming caffeine, nicotine or alcohol before bed. And then shift work or a frequent travel, because some people will be going for a day shift, then night shift. Due to this shift changes, their sleep pattern will be disturbed. Next one, due to the medical comorbid conditions, due to any chronic pain such as due to arthritis, fibromyalgia, and then respiratory problems such as asthma, sleep apnea, neurological disorders such as Alzheimer's disease, Parkinson's disease, and then hormonal imbalances such as menopause and thyroid issues. These are some of the etiological factors. And then due to medications also, some medication will cause insomnia such as antidepressants, corticosteroids, decongestants, stimulants for ADHD or weight loss, and even antihypertensive medications also. Next, we are moving on to the clinical features. So, what would be the clinical features means? There will be a trouble in falling asleep despite of feeling tired. Even though they are feeling tired also, they can't able to sleep properly. And then waking up multiple times at night, waking up too early, as we will all getting up at 4 o'clock or 5 o'clock. These people will be getting up at even 2 o'clock also and not being able to fall back asleep. And then next clinical feature is feeling unrefreshed after sleep. Normal people will be feeling refreshed after they are sleeping from night to night and all. If they are sleeping properly, in the morning they will be feeling refreshed and they will be very active. But when a person is having insomnia, that concerned person will not be feeling refreshed after their sleep also. due to this sleeping disturbance. Next one is daytime fatigue, irritability and mood swings will be there, as they are not having a proper sleep schedule. Due to that, they will be in an irritable mood, and they will be having often they will be having mood swings. Next one is difficulty in concentrating on their studies or on their work or remembering things. They will be forgetting it easily. These are the clinical features. Next one, side effects of insomnia. If it is not treated, what and all it will lead to? We will be seeing one by one. First one is, it will increase the risk of heart diseases, and blood pressure will be increased, and blood sugar level, that is diabetes mellitus, will be caused. That is the first one. Next one is, it will reduce the immunity function of the concerned person. Third one is, weight gain due to hormonal imbalances will be there. Next, impaired cognitive function, memory loss, they will forget things easily, and risk of accidents, and increased risk of mental health disorders like anxiety and depression. These are some of the effects of insomnia if it is untreated. Next, we will be seeing about the treatment modalities for insomnia. The first one is lifestyle changes, because due to the sedentary lifestyle changes, the sleep hygiene is affected nowadays. So how we can able to modify that again to a normal sleep hygiene? That's what we are going to see now. First, we should maintain a consistent sleep schedule. That is, we should have a constant timing to go to bed and wake up on time at the same time every day. That is very much mandatory for every individual. Create a relaxing bedtime routine. That is like, before you're going to bed, what and all you should do to relax yourself. That is, you should not switch on to your phones before 1 hour to the bed. You should read some books, you can meditate, you can take warm bath. This and all you can do. And you should avoid the screens at least 1 hour before bed. It might be a TV, or it might be mobile phones or tablet or whatever it is. Next, we should limit the caffeine and nicotine, alcohol, especially in the evening. Obviously, it is taking all this will affect the people health, but completely it should be limited. Exercise regularly, but not right before the bedtime. That is, you can exercise in the early morning, but it should not be before the bedtime. It's well and good if you are doing it in the morning. Next, make the bedroom comfortable. It should be cool, it should be dark, and it should be quiet. Then only we will be getting good sleep. In such a way, we can maintain a good sleep hygiene. Next one, cognitive behavioral therapy for insomnia. So, what is cognitive behavioral therapy? The affected maladaptive behavior will be identified. The negative thoughts about the sleep in this condition, the negative parts about thoughts about the sleep will be identified, and that will be changed into positive thoughts about the sleep. Then we can teach them relaxation techniques and breathing exercises, and it will help to establish a better sleep habits. That is what cognitive therapy will do in this insomnia. Next one, medications can be taken if it is necessary, but taking over the counter drugs is also not good. There are options to take over the counter drugs, but it is not advised. And then prescription options are there for sedatives, antidepressants, medications, especially for insomnia. Next, sleeping pills should only be used under the doctor's supervision, and it is for not longer term use. Next, we can go for natural remedies like herbal tea, magnesium and calcium supplements, aromatherapy with essential oils like lavender. Apart from that, home remedies are very good for insomnia. Like, you should set a routine for yourself and limit the screen time, exercise regularly, eat wisely, and practice relaxation techniques. These are the best way to overcome insomnia. When we should meet the doctor if a concerned person is having insomnia means if it is lasting more than 3 weeks and if it is affecting your daily lifestyle, mood or health. At that time you should meet the doctor. If you suspect an underlying medical conditions like sleep apnea, in that case you should meet the physician. It is mandatory. Thank you.